They're probably getting into their bed. They're probably having something to eat. We love you guys, man. Big up all the doctors all over. I want to shout out to Dr. Shivani Prasad, Dr. Obadali Turn, Dr. Judy Hung, and the list goes on and on. And I see you walk away from me. Yeah. Ooh. And baby, so they celebrated Doctors Day sometime during this week. So I want to wish everybody, all the doctors out there, happy Doctors, belated Doctors Day.
Records had a hold on me. Just wouldn't let them leave.
It's a lonelier place. I kiss the morning goodbye, but down inside, you know we never know why. The road is narrow and long when eyes meet eyes, and the feeling is strong. I turn away from the you into my world and hold you within. It's a ride I defend over and over again. What do I do? With you eternally mine, in love there is.
So we're going to get right into that talk, and I'm going to introduce Dr. Jamal Shamsuddin, and I'm going to let him take the floor and tell you a little bit about him. Good morning, doctor. How are you?
Good morning, Anne-Marie. So thankful for you having me here on Sunday Simo so that we could discuss very important thing facing the Guyanese population.
And I am so happy that you're here because I know personally that doctors their job is so demanding. I mean, a job like that is, I think it's not a job to have any life at all. You don't really have much time for your personal life or, your partner.
Yeah.
I honestly think that. And I have to commend you as well as all the doctors because it's a profession that you choose that you're being very selfless.
Yes,
very
definitely
selfless.
self-sacrificing. You're taking pieces of yourself to ensure that your patients are well taken care of. So for sure, definitely a profession of self-sacrificing.
So you would have to have an understanding partner or family that are around you that hey, I
Yes.
can't have as much time to.
For sure, yeah.
But when you do have the time, it's really, good. You try your
Yes.
best to give all to that little time because it means so much to you.
Right, it's very valuable. Free time.
And I
is
keep
something very
telling
hard to
people
come.
that that doctors, they don't realize that doctors should be praised and praised because you guys really go all out. The hours you spend and the time you spend to study, and apart from your patient, sometimes you go home and you have a patient on your mind.
Yes.
Right?
Yes.
So the work is, although it's done there, you're still in your mind. So that's why you need
and
to.
then even when you're finished with work, you still got to go home. You got to hit the books because this profession is something it's a
You have to
lifetime
keep
of
up.
studying. Yeah,
You have to keep up.
definitely keep up to date.
So introduce yourself. Let me have your full name. Tell me how long you've been a doctor. Tell me
So-
what inspired you to be a doctor.
Right. So my name is Dr. Jamal Shamsuddin. I am currently working at GPHC
Nice.
in the internal medicine department, in the department of hematology. I've been inspired since I initially was a teacher and of science. I taught at the CXC level for about 5 to 6 years at different schools, and I wanted to further my education. And while I was at the university, I did a associate's degree in chemistry.
Wow.
And while I was there, I decided I then started looking into medicine, and it was something exciting for me. There was a lot of complaints on the university that it's a difficult program. So I wanted to join the program to show that it was not something
You
very
like the
difficult.
challenge.
Yeah, I like
Oh,
the
you like
challenge. That's how it
challenges. That's
initially
good.
started. And then when I took up the challenge and was then in the field itself, my passion and love for medicine, and anyone who knows me would know, I could talk all day
That's
about
good.
medicine.
That means
That's
you
why
love
this
it.
show is perfect for me.
Yeah, yeah. And listen, you can come on as much as you want on this show because I can see you have a lot to offer when it comes to sharing your knowledge and experience with us and helping the public to better take care of themselves health wise, because that's something we need to do for
Yes.
healthier lifestyles all around the world, not only in Guyana.
And that's why the radio show is so great, because in practice, you sit one on one with patients and you can only see so much
Wow.
patients in a day or a week. But on the show, for example, now we can reach out to hundreds of people now. So in one session, one radio session, we can reach hundreds of people. We can
that's
educate
true.
them on what to look for, how to appropriately manage different illnesses, and so on. So this is perfect for the Guyanese population.
And why did you choose the topic today? What is the topic today, Di?
So we are going to be looking at diabetes mellitus, in particular type 2, because this is a chronic condition that's been facing a lot of Guyanese, especially with the older population, but in the world in general. And it's something, there's a lot of myths and misconceptions concerning diabetes. So we're here today to basically shine light on every aspect of the illness,
Diabetes.
so that because it's so chronic and lifelong.
And that's why you choose to speak about
Exactly,
this,
right,
because
right.
there's a lot of people,
Exactly.
a great amount of people that
Yes.
suffer with it, and you would
Yes.
hear it. So let's get right into it. What is diabetes for the people who don't know?
So basically, diabetes is a chronic condition, meaning it is long lasting. And so when we eat normally, our body absorbs sugar through the intestines, simple sugar or glucose. And for it to get into the cells now, there's a special hormone by the name of insulin. Insulin acts like a key to the door to open the door of the cell so that that sugar can get into the cell. However, in people with diabetes, especially type 2 diabetes, that key, that insulin, has either lost its effect or there is no key, meaning that the organ that produces the insulin is not working as it should. And because of that, the sugar is locked out of the cell and it stays in the bloodstream. And that's what causes all of the issues, all of the complications, basically in a nutshell, of diabetes.
Okay, and you were mentioning earlier, just where you're talking about type 2. So there are different types of diabetes, right?
Yes.
So
So basically, they have generally we have two types of diabetes more commonly known, and there's even a third type, a more specialized type we call gestational diabetes. But when we talk about type 1, this is usually because of an autoimmune disorder, meaning that for some reason the immune system thinks that the cells of the pancreas are not yours, and they attack your own cells of the pancreas. And when that happens, the pancreas, which is the organ that produces insulin, is unable to produce insulin. And this usually shows up early in childhood or in adolescence. However, in type 2, this is usually diagnosed in adulthood. And this is where we have either not enough insulin being produced, or what we call clinically in our profession is something called insulin resistance, meaning that the cells of the body, which normally needs insulin to take in this sugar, so for some reason the effect of the insulin is just not there.
wow. Which one is worse, one or two, or
So I wouldn't say I at this point I wouldn't say that one is worse than the other. It all depends on how early we catch it, the management, how well the patient is following up with their medication and their lifestyle changes and all these things. So this is another important point, that diabetes is not a death sentence. People hear diabetes or sugar and they think, oh my God, What am I going to do here?
But some people do lose their limbs. Isn't
Yes,
that so?
yes,
And
that's
that's a
correct.
result of what? Them not using
So
their.
that's usually as a result of poor management,
Oh, I
because the
understand.
research, the medication, the lifestyle changes are very, very effective, especially when it comes to diet, it comes to exercise. These things are extremely effective at managing and keeping the blood sugar within the normal ranges of what they're supposed to be.
So what do you think? What is the causes? What brings up this sugar? These causes of diabetes? What causes diabetes? Is
Right.
it
So
something that you just grow into, or something? I don't know.
this a very, very good question, because a lot of persons would want to know how is it that I ended up with diabetes,
Right.
especially type 2, sorry. So
Mhm.
one of the first things we can look at is genetics. So there's a family history
Really?
of diabetes, meaning that if you had relatives, first degree relatives, mothers, brothers, second degree relatives, aunts, cousins, and so on, with a history of diabetes, you are predisposed,
Wow.
right, to diabetes.
So that's
But that
out of
doesn't
your control. I mean,
yes,
especially if it's
that's just one
genetics.
part.
Yeah.
And then in general, the cause is multifactorial, meaning that there's more than one thing that can cause it. So you have the genetic component as
Right.
one aspect,
Mm-hmm.
and then you have the lifestyle aspect as another point. So things like being obese or overweight,
Mm-hmm.
sedentary lifestyle, meaning very little to no exercise,
Mm-hmm.
things like that, in combination with these genetic factors, predisposes you to diabetes.
Diabetes.
And notice that I'm using the word predisposed,
Yeah.
because not because you have a genetic component and you have the lifestyle changes, it means that automatically that you will develop diabetes, but the likelihood is great.
Right, right, right. And as you said, it's manageable, right? But it's not curable. Diabetes is not curable, is it?
Right. So at this point, there's no cure, but it's very manageable, especially in our healthcare system. We have most of the things needed to manage diabetes quite effectively.
And I have a question. Like for the
Sure.
patients that have diabetes or people that trouble with diabetes, it's very hard. I know because you would have to abstain from certain food
Mhm.
and things that you would normally enjoy eating and stuff. Um, what do they what do they eat? Is there sugar free items? Because I'm pretty sure there's sugar free biscuits and stuff. How do
Mhm.
you guys go about that? Telling them, because some people with a lifestyle change,
Right,
it's very
right,
hard. And
right.
for people who are now in, like, I now know I have diabetes, they know they have to, and they find it hard. So I'm wondering if the doctors would tell them, oh no, there is a lot of sugar-free biscuits,
Mhm.
sugar-free drink. You can still enjoy a soda, it's
Mhm,
sugar-free.
mhm.
Because I know that for a fact, there's sugar-free soda,
So,
right?
right. So in diabetes, there is nothing that you cannot eat. However,
Mm-hmm.
the body is such a balanced tool. Everything must be done in moderation.
Wow.
So, let's say, for example, maybe it's a special occasion and there's cake, for example.
Right.
A diabetic doesn't necessarily have to skip eating the cake, but they must do so in moderation. Whereas a normal person may be able to take a slice or even two, the
Right.
diabetic now must cut um,
Slice
that
into
amount, right,
a
portion
smaller
control
portion.
into a smaller amount, because they should be aware that what that would do for their blood sugar, that would cause a spike in blood sugar. So they now have to, they can partake in the cake, but they then have to watch their portion control. And of course, their sizing is not going to be the same as a non-diabetic person who can
Right.
handle it, because the normal or healthy person, their pancreas can keep up with that sugar. In diabetics, it's not quite the same.
So, what are some of the symptoms? Like, how would I know if I'm just a normal person going about my business? What are some of the symptoms that is alarming for you to say, okay, you know what, I need to go check to see if I might be suffering from high blood sugars or if I'm diabetic? What are some of the symptoms that
Okay,
you would look
so
out for?
the first thing that we can talk about is fatigue.
I just
So,
feel fatigued, doc.
yeah, so there's it's in a combination of symptoms: fatigue, excessive thirst, excessive hunger, and excessive
Wow.
urination. And let me explain to you how we get to these points of fatigue, for example. I once had when I was in medical school, I had a biochemistry lecturer by the name of Dr. Emmanuel Cummins. And when he taught us about diabetes, he would always use a catchphrase, um, hunger in the midst of plenty. So what that means is that we know that in diabetics, their blood sugar is high, but somehow they feel fatigued because they have low energy. So how is it that the blood sugar is high, but we're feeling fatigued? Now remember earlier at the beginning of the show, I talked about insulin being that key.
Right.
So there's lots of blood sugar in the vessels, in the veins, in the arteries, in the blood basically. However, that key is not there to open the door for that energy, that substrate, that fuel to get into the cells, so the cells to actually use it.
I understand.
Hence,
Makes
exactly
sense.
that
Yeah.
that now is where he coined the term starvation of the cell in the midst of plenty sugar in the blood, because that
Wow.
key is not there to get that sugar into the cells.
So you can feel energized,
Yeah.
or yeah.
So
Oh,
that's
wow.
one of the first things.
Lack of energy.
Fatigue,
Fat-
fatigue.
lack of
Then we
fatigue.
have excessive thirst or excessive hunger. Now, excessive hunger, for example, links back. If the cells can't, even though the glucose or sugar is there, and the cells cannot access that glucose, they're going to send out signals to the body saying, well, we are still hungry. There's nothing coming in here.
Wow.
So even though the blood sugar is high, you would feel very hungry. And there's a term we use in the hospital, we call it polyphagia, excessive hunger. Back again to the body being a tool of balance. It's finely tuned. The body knows exactly what the level of sugar is supposed to be. So
Right.
what it does is all this excess sugar, glucose in the blood, it tries to get rid of it through the kidneys in the urine. And by doing that, trying to get rid of that excess or spillover of glucose into the urine, we have frequent urination,
Wow.
what we call now polyuria, right? And because you're frequently urinating, what's going to happen to your body's supply of fluid? It's going to
Right.
deplete or go down, and now you begin to feel thirsty.
Thirsty, yeah.
So now we got polyphagia, the three P's of diabetes, I call it. Polyphagia, excessive hunger; polydipsia, excessive thirst; and polyphagia, excessive hunger.
Wow.
Yeah, the three
That's-
P's.
So those are the symptoms you have to do. So if you see you're and even if you're having 2 out of 3, you still should check
Yes,
yourself.
yes. So, because it's such a chronic condition and these symptoms are so non-specific, that's why it's always good to do checkups.
Is there a specific age range that trouble with diabetic, or more older or more younger, or is it just any balance?
So anybody can have diabetes.
But
It could occur type
what
1
more
or
of the
type 2, but
population
generally those older than 40, 45, according
are
to
more
the
troubling?
American Diabetic Association, in that range, those are the ones who should really start beginning to screen themselves for diabetes.
So yeah, let's talk about diagnosis of diabetes.
Right. Okay. So one of the things that we use uh, at the hospital or at the clinical setting, what we call the history. We need to find out as much as we can about the patient before, because as we mentioned, there is a family or a
Genetic.
genetic component. So we need to investigate or look into if at any of the family members of the patient and if their relatives would have had a history of having diabetes.
Right.
That's a tick in our mind.
Wow.
So after the history and asking pertinent questions about the signs and symptoms if the patient is experienced, we move on to physical examination, where we look for certain things, like for example, poor wound healing. That's one of the things associated with diabetes. If you notice that when you were younger, you would get a cut on the hand, it would take about 3-4 days to heal,
Heal up,
and
yeah.
now all of a sudden I have a cut similar to the one I had when I was 18, and now it's taking me 4 weeks to heal, and
Wow.
this is just not healing up. That's another sign. And that's some things that we look for when we're doing our physical examination. How long you
Right.
had this cut, how is the healing looking like, and things like these. We also do blood tests. That's one of the more important aspects of diagnosing.
accurate, I
More
would think.
accurate,
Ah.
yes. One of the tests that we do is something called a FBS, which is a fasting blood sugar. So after an overnight fast, you present yourself to the lab, they take off a blood sample and they test it. Now, ideally, in persons who are fasted and normal, meaning don't have diabetes, their blood sugar should be from 126 or lower. If it's above, then that is a tick in our head. But to note, for this test, just a single FBS we cannot use that to diagnose diabetes. It must be on two separate occasions of 126 or higher. Another test that we can use is something called an HbA1c. That tells us how the blood sugars have been over 3 months.
Right.
So you're probably wondering, how is it that one test can tell you
Right,
as a
that-
doctor how
Right.
your sugars have been over 3 months?
Right.
So an illustration that I like to use for my patients is, if every time you go to the seawalls or to the beach, you
Right.
pick up a pebble every time and you take it home every day, one single pebble,
Right.
and I come and I come by you and I see you have 7 pebbles,
Right.
it means that you must have been to the beach 7 days because
Right.
there's 7 pebbles.
Right.
So basically, in this test, they look at the HB in the red blood cells, and basically that HB collects glucose. Basically, in simplest of terms.
Right.
So when the technician looks at that, they can see the amount of glucose
Wow.
in that HB, and it could tell us how much glucose or how your blood sugars have been
Wow.
over a 3-month period. So that's a very important test. And for us, we want anything above 6.5% in your HbA1c will tell us that your sugars have not been good over the past 3 months.
So you just don't carry just one test and say, okay,
No.
you're you make
No.
sure that's good.
Yes, you have to make
because
sure.
sometimes one test might and then another test come and then you're fine. So that's good that you carry out more than one test. And let me butt in a little bit. The patients that you would have had
Mm-hmm.
that would be diagnosed with diabetes, how do they take that news? Are they frustrated? The percentage, most of them are frustrated, or they're, all right, I'm going to use my medication. How do you find working with people that have diabetes or now learn that they have diabetes? Are they complicated to deal with? Is it hard to deal with them?
So, in my personal clinical
Right.
experience, I found that on initial consult with patients, they are, a bit shocked, of course.
Right.
However, on second consult, after they would have gone home, and this one thing I like about some patients, they do a lot of research, they check, they
The
read, and
internet
so
is
on.
there. A lot of people are trying to help themselves with
Exactly,
information. They want to come
right.
and do the doctor's job. Something. I'm sure some of them be
Google
telling you, doc.
doctors.
I read and this and they telling you, what will you be doing? What you be
Yeah.
doing when they be telling you, doc? So they telling you, what you be doing? Laughing.
Well, in my mind, I smile, I smile and I listen to them and so on. But at the end of the day, they have to know
Educate
that
themselves
right,
to best know how to deal with
right,
it.
because not everything on the internet is correct.
And that's
Yeah.
true.
So on second consult, after they've had this opportunity to read and check stuff out for themselves, they're a lot more willing and compliant to the information and the counseling that we're going to give them. So
Oh,
I
so
find in generally, some of the patients, they are well accept the news well, and then there are others who they don't really believe in
they're in
medication.
denial too. They're in
and so
denial.
on.
This
Exactly.
is not. It can't
Exactly.
be. Yeah. Well, you would find that. So how do we manage diabetes? How do we, as you said, it's not curable.
Mm-hmm.
So it's something that we have to live with throughout our lives. So and I mean, some people find it hard to live with something throughout their life, but it is manageable. It's just not curable. How do we manage diabetes?
So, for a patient or a person who has newly diagnosed diabetes, we don't just rush
Right.
straight into medication.
Right.
We want to do something we call lifestyle modification
And changes.
which is very
Nice.
important because this you can actually keep away the complications and keep your blood sugar well managed with just lifestyle modifications. And lifestyle modifications would include exercise and diet. So when we talk about exercise, It used to be 30 minutes 3 times a day. However, the American Diabetic Association has now said they want 150 minutes per week of exercise over a 3 day period, which would mean 50 minutes of moderate to intensive exercise for 3 days a week.
Wow.
However, when anyone is starting their exercise regimen, it's always important for you to speak to your doctor, your healthcare professional, to see if
Right.
you can handle certain exercise regimen, because a lot of these persons, they would also have other illnesses like heart disease and so on, and they may not be able to handle moderate to intense exercise.
Right.
So it's always important for you to speak to your doctor before starting exercise. But exercise extremely important at keeping your blood sugar down, because when you use your muscles, it helps to take some of that sugar in the blood out of the blood and use it in the muscles when you're exercising to keep your blood sugar at a nice stable level. In diabetes, we don't want the sugar too high, we don't want it too low, we want it in this exact range,
Right. Right.
right? So another thing, an adjunct or another thing we can do, apart from diet or along with diet, exercise, sorry, is your diet.
Diet.
And one of the things we like to use in counseling patients is called the plate approach. So if you look at your plate,
Right.
we can divide it into what you need. So the first half of your plate, you want to fill it with non-starchy vegetables. And when we say non-starchy, we don't want anything like cassava, sweet potato. No, no, no. We're talking vegetables, strictly vegetables
Right,
here,
right.
non-starchy vegetables, leafy greens, broccoli, peppers, tomatoes, carrots, things like that. That's half the plate.
Right.
The other quarter now, we want protein, but lean protein. Chicken breasts,
Fish.
other forms of chicken too, but we don't want anything fried and things like these, right? Lean protein. The other quarter of the plate now can be filled. That's where you could have your starchy stuff. So just a little quarter.
Just a little bit.
Yeah. So
Because
that's
you still need a little
completely
bit of that
that's
sugar.
completely opposite from how the typical Guyanese eats, where
I know.
you
I'm,
have that
I'm listening
mountain.
to that plate, and
Yeah, there's
you,
a mountain
you
of
yourself
rice.
know that we don't do
Yeah,
that
yeah,
here.
yeah. The mountain of rice, and then the
So
little bit of curry or
it's
so on
gonna
top.
be hard to manage. I mean, with the lifestyle changes, it's gonna be a little challenging. I wouldn't say
Yeah.
hard. I don't like to use the word hard for people that are now, introduced. Oh, we're diabetic,
Yeah.
and we have to change our lifestyle because in the Caribbean, I think it's a normal thing, not only in Guyana, for us to
Yes,
eat
yes.
this hearty
That's
kind of way.
Yeah, that's worldwide basically, because fast food is cheap and it's easy.
Yeah.
And so a lot of people turn to that for their nutrients and so on. It's so easy. You're at work to just go outside and grab a Coca-Cola, grab
Something to eat.
something on the road or
What
so.
about the fluid intakes for people who have the lifestyle changes? Is there anything that they can use to drink instead of, like, if they don't want to eat? Some people that have diabetes don't have much appetite from time to time. Or with the lifestyle changes, it closes their appetite, if you understand, because they can't eat how they accustomed to. They're eating things that they don't really like. Or what can they do to drink? Like, is there anything that they can drink to boost them, to give them that all the nutrients that's sugar free?
Yeah, so you can supplement, but generally speaking, our diet is usually this same plate approach. For example, if you follow that, it should be enough to give you all of the vitamins, minerals, and nutrients that you need to live a healthy lifestyle. What I would recommend is for them to experiment and investigate different foods that they like and what they don't like, and find something that works for them.
them.
That's why it's important for you to sit with a one-on-one with the dietitian or with your doctor, so that they can help you to find things that you like. For example, you may like lettuce,
Right.
I may not, but I may prefer cabbage.
Right.
Right? So I can use cabbage, you can use lettuce, and we're both healthy. You may like carrots, I may like tomatoes, So you gotta experiment, you gotta find what works for you. But the important thing is keeping that blood sugar in that normal range that we would want it.
Okay, so that's good to know. So
Yeah.
it's about changing your habits of
Right.
eating and drinking, and you can manage it, right?
Yes.
You can
So
manage it.
apart from the lifestyle modifications, we have something that we like to use in treatment in clinical practice called the ABCs of diabetes. So the A, which stands for the HbA1c, that's what we talked about earlier. We want to keep that below 7.
Right, below
We
7.
want to keep that below 7. The B, your blood pressure,
Wow.
right, is important because usually persons that are diabetic, they are also hypertensive or have high blood sugar. Blood pressures.
Right.
So you want to get yourself in a clinic, get yourself in a health center, and thankfully in Guyana that's free. You go to your nearest health center and they would be able to help you with your blood pressures. You want to keep that below, according to American Diabetic Association, 130 over 80 ideally.
Okay.
Cholesterol, extremely
That's a big factor.
extremely important, right? We want to keep that cholesterol. We got different kinds of cholesterol. There's bad, there's good cholesterol, and then there's your triglycerides. You want to keep that bad cholesterol below 100 ideally, and the good cholesterol, which is the HDL, above 40 for men and 50 for women.
Wow.
So that's C. So just to recap: A, HbA1c, below 7. Blood pressures, B, below 130 over 80, and cholesterol, we'll just keep in mind the bad cholesterol. We want that below 100. And diet, there's D. We spoke about diet with the plate approach. And then there are also drugs, medication.
Yeah, I was to ask you about that. So
Medication.
with the diet, most patients would need medication with it, although they're following the dietary, the change of intake of food or what they're taking. They would have to have, most patients would have to have medication for diabetes. Is compulsory with the lifestyle change?
It's not
or-
necessary. So when we see patients, it depends on the level of these tests that we do, how bad or how elevated these blood sugars have been, that we would know at what point we can just do lifestyle modifications for this patient, and we can just do medication and lifestyle changes for this, or we would need to step up. So that's why, back again, it's so important for you to be in that health center, because what works for you,
Might not
for
work for
example,
somebody
might not
else.
work for me, right? So you can maybe do lifestyle modifications, and me now, I might need both lifestyle modifications. I might need medication. I might even need insulin. All right.
So what about the patients that they're not following the lifestyle? Because we know we start something, most of us, especially if it's a new change, and then we go back to old habits. It's like, I'm tired
Yeah.
of this. I want to
Yeah.
eat my plate of rice. Would the medication work for them alone, although they didn't change that lifestyle? It would still help them. It would still be manageable, or no, they have to change the lifestyle.
So for me, I would always advocate for lifestyle changes.
Right.
However, there are cases, indeed, as you mentioned, of patients who they're not about that. They're not about to
Right.
diet. They're not about to exercise. However, we still go ahead. We treat the patient with medication, and medications have been found to work. But if
Right.
you want maximum effect, in
Right.
combination, the two can knock that out of the stadium, knock
Right.
that high blood sugar out of the park.
And it would actually cause, because I know some people that have diabetes, they
Mm-hmm.
would lose their limbs. So I'm
Yes.
assuming, as you said, lifestyle with medication would
Yes.
avoid you from going
Right.
that far
Right,
down the
right.
road of
Exactly.
diabetes.
So what happens in these patients, or these persons who lose the limb, is that this high blood sugar, because remember, we can't use it, it's in the blood all the time.
Yes.
It actually damages the vessels and the nerves of your extremities, especially in the feet or in the lower limbs. And when that happens now, you start with diabetic ulcers. You begin to lose feeling, and because the vessels are damaged, and that's responsible for carrying nutrients and healing factors and so on to these areas. Now, when you have any injury on the feet, they're very, very slow to heal. Also, because you can't feel as well as you used to, you don't. Sometimes you don't even realize that you actually have an injury there that's festering, and over time that could become infected and worsen into a diabetic foot also, and eventually, sadly to say, some persons do indeed lose their limbs. That's why so important for you to get yourself into that
Lifestyle.
lifestyle modification.
and
Even
medication.
if you don't have diabetes, it's always good to eat healthy, to have a moderate amount of exercise every week. All persons, regardless if they're diabetic or not diabetic, should be having some form of exercise.
Yeah, but that's something Guyanese don't do. I shouldn't say Guyanese because they might come for me. Well, a lot of people don't really exercise, and I speak for myself as well, because simple walking is
Yes, yes,
exercising.
correct.
But sometimes you're so, but there's nothing to justify that. We need to exercise every day. It could be just skipping in the yard with a rope, a skipping rope. It could be just walking,
Yes.
pacing around the
Yes.
yard, your yard. You don't have to go out to
Yes.
exercise. It could be,
Some
the
jumping
ladies like
jacks,
to
yeah,
do their
yoga and so
yeah, in the
on.
in the
Right.
house. They got their mats. They're
Yes.
squatting,
Yes.
whatever. All of that is
All of
exercise,
that,
and it's
yeah.
good for your mental
Yes,
health as well.
exactly.
So
Exactly.
let's talk about some of the complications that comes with diabetes. I think we would have touched on that that just now when we say losing the limbs, but we're going to get more into it. What are
Yes.
some of the complications? Sorry, that comes with a diabetic or
So-
diabetes. Sorry.
One of the most important ones I want to discuss about is the cardiovascular disease that is associated with diabetes. So high blood sugar levels, as we mentioned before, can damage your blood vessels and increase the risk of plaque buildup within the vessels. So, for example, persons who may be predisposed or have heart attack, the issue with that is that the vessels that are supposed to carry nutrient-filled nutrients like oxygen and energy and so on to the heart,
Wow.
they become filled with plaque.
Wow.
So you have a decrease. So it's like if you have a hose and then you put a little stone inside and barely any pressure is going through
Right.
to
Right.
supply the heart now with blood, the heart itself with blood so it can keep pumping. So when that blocks up now, you end up having a heart attack and
Wow.
that
So
area of the
diabetes
heart.
can actually
Yeah,
cause that
yes,
if
yes,
not
because,
treated.
Yes, because it increases the risk of that plaque build up
Wow.
within
I
the
didn't
within
know
the
that.
heart. Yeah.
Yeah.
It can happen in the heart and it can happen in the brain. So they're also at high risk of stroke, cerebrovascular accident, as we call it in the hospital.
Wow.
Right. So that is very important. That's why you want to manage that diabetes. You don't want to reach that point where
You're gonna
you
get
have a heart
stroke
attack
or
or
a
a
heart
stroke,
attack. Yeah.
and then you say after the fact, oh my,
I
maybe
mean,
now, yeah,
yeah,
the
but
damage has
most-
already
yeah,
been done. You know.
Yeah, yeah. You
We
want to
also-
avoid that. Prevention is better than
Thank you.
cure.
Exactly.
Yeah.
So we also want to talk about kidney damage,
Oh.
diabetic
That's
nephropathy.
that's a tough one.
Yeah, because we know a lot of persons
Dialysis
now,
is very expensive.
very
Gosh.
expensive, and it's a very tough thing to live your life around having to dialyze yourself weekly and so on.
Mm-hmm.
So that's why this program is so important to you. Before we even reach the point of dialysis, we can
Yeah.
do simple things like exercising.
Yes,
So
exercising.
you can imagine which you would rather have to do dialysis 3 times a week or exercise 3 times a
Exercising.
week.
Yeah, it's
That's
better.
the kind of decision that you need to make in your mind at an early point.
Right, right.
And that's why you need to take your health serious. So that blood sugar damages the kidney, and your kidney function actually goes down. So over time, you can move from acute kidney
so
damage
diabetes, So diabetes can really cause a lot of different
Yes,
complications.
yes.
A lot.
You can lose your eyesight.
Wow.
You can have stroke, heart attack, injury to your kidneys, skin problem, dental caries with your cavities, issues with your teeth, poor wound healing, diabetic foot ulcers. So many things can occur because this amount of blood sugar is in that blood, high blood sugar. Right? So that's why we always talk about constantly keeping the blood sugars within the nice, normal, healthy range. Yeah.
Yes. And what are some of the misconceptions of diabetes? Myths and misconceptions.
Right. So one of the things I really want to touch on, because in Guyana we call diabetes sugar.
Yeah,
So people
that's
think-
a normal thing.
Yeah,
sugar. You got
yeah.
sugar.
So they
You
think
could
that
sell me the sugar.
only sugar, only sweet things
Sugar.
is
makes
considered sugar.
sugar,
But when we talk about sugar, we talk about any glucose, any form of energy. For example, potatoes.
Mm-hmm.
A lot of people think, oh, it's potato. It ain't sweet, so it ain't got sugar.
Sugar,
But that's not
oh. Mm-hmm,
true. We're talking about carbohydrates. When we use the term glucose. So it
Right.
doesn't necessarily have to be sweet in order for you to consider it a source of sugar or
Right.
glucose. It's not sugar in the traditional sense of a sweetener,
Right.
right? Fruits too, you got to be careful with with overdoing certain fruits. I remember once when I was initially starting clinical practice, I had a patient that came in, and we did a random blood sugar on the patient, and it came back high, HI. That
Right.
means the sugar is so high that the machine can't even read it.
Wow.
And I remember they said to me, they said, he has no idea why his sugar is so elevated. And so we sat and we had a little discussion, and I said, what did you have for breakfast? And he said, well, I eat six mango, six ripe mango.
That has a lot
Yeah,
of
exactly.
sugar
He didn't
fruits.
realize that he was thinking, it's a fruit, so it's
Right.
healthy.
Right.
So when I eat it, I should be okay.
Right.
But
Right.
we gotta be careful with fruits too. Fruits, remember, our source of sweetener comes from fruits, sugar cane, beet, and so on. Different fruits are actually types of sweetener, so we gotta be careful with your fruits as well. So when we talk about sugar, it's not just sweet things, but anything high starchy, things full of carbohydrates, potatoes, ground provision, rice,
Barley.
wheat,
I think barley is
barley,
full of
yes,
starch, right?
yes.
Yeah.
All those things can be considered sources of sugar in the scientific sense and not in the traditional sense of a
So that's
sweetener.
one of the biggest misconceptions. People think, oh, if I eat a lot of cake and sugar cane and
Yeah.
sugar cake and all these
Yes.
stuff,
Yes.
then is when I'm gonna get diabetes.
Yes. So
Or
it's
they're
not
gonna
just
take
that.
my blood sugar up.
Yeah, it's not
But
just that.
that's just some.
Some,
But
some,
most of
some.
it is normal food that we're eating that has a lot of starch, carbohydrate
Right,
inside.
exactly. Like that rice, that mountain of rice that the Guyanese love.
That's a lot of carbohydrate or
Yes,
yeah.
yes, a
Oh
lot of
wow. And
starch.
bread
Starch is
too. Bread,
carbohydrates. Bread, yeah, bread.
bread. And we
Bread.
love we bread. Oh,
Yes,
we can't live
bread,
without we bread.
roti.
Roti, I love a
Yeah,
roti, doc.
yeah. We also think I got a lot of persons who also think that only people who are overweight or obese can have diabetes, but
Yeah.
that's not quite so, because remember we mentioned before the genetic component and
Mm-hmm.
sedentary lifestyle. So you can be thin and
And
sedentary,
still,
not exercising and not having the right diet, and you can still be predisposed to diabetes and you can still be diagnosed with it. So
wow.
all across the board, you should go ahead, get yourself checked, get yourself in a
Especially if you're
clinic.
having the symptoms that we
Yes,
outlined.
a lot of times too, we know our body tells us when we're not feeling 100%.
Yeah, you could
You
get
know,
yourself checked.
when you feel like that, you should get yourself checked. There's so many, almost, I would say all doctors at some level know to manage diabetes,
Yes.
hypertension, and so on. So it's always good to get that checkup. I think we are now moving to a culture in Guyana where people are more concerned about their health. They're more
Yeah, they
concerned
are.
about doing yearly checkups and so on. And the Guyanese population must be commended for that.
Yeah, truly. And how do you find that the diabetes population, you find that people are more cooperating and you guys are managing it and keeping it, at that rate that it has to keep, or you find it's a little out of hand?
So
I mean, you're dealing with people
yeah,
all the
so
time.
I think it's a give and take. There are some patients who are really excellent,
Wow.
really
That they
excellent.
wanna.
So one of the things that we advocate for is for you to have your own at-home blood sugar tester.
Right.
And so we encourage patients to do sugar logging or RBS, random blood sugar logging in a book, the time and what was the amount and so on. So when they come to us, we can see over
And
a
that's
period of
after
time.
every meal. That's
Af-
after
or
e-
before,
or before.
right? So
Before
your
and
doctor
after.
would tell you
guide
when
you.
exactly would guide you when you should take off that blood
Blood
sample. And so there are patients who would actually come with the book and they would remind you, Doc, remember I got this book. Hey man, you remember you tell me
They
for
feel
take
nice.
this thing and
They
so
want you
on.
to check the
Yeah, they
book,
want to
yeah.
make sure that when they leave, that everything is in order. And then there are some patients, which I think is possibly from a lack of education or knowledge on the
Right.
disease or on the disease process. They don't quite understand why is it that they have to do certain things. And because in clinical practice, the turnover is so quick, you see so much, you can't sit with the patient always 2-3 hours for you to explain
Yeah,
every single
that's
nitty gritty, because
true.
you have other patients you have to see and things like that. But that's why this show this morning is so important,
Yeah,
because
because
now we can sit.
we're reaching a lot of people. There's a whole lot of people on the live. There's, greetings coming over, and we're gonna definitely do a follow up. But we have two more. You're gonna conclude and research now, and if there's any questions, guys, on the live, we're sorry, we're just trying to get this information out there over so you guys can be educated as much as possible on diabetes, how you can the symptoms you can look for, what you can do to better yourself. You know you need to see a health care a doctor for sure, and we hope that if you have any questions, we're definitely going to do a follow-up show to answer all your questions, but I would like to think that we would have touched on everything. And doctor, I'm leaving you on the floor now to conclude and research. So you're gonna finish off here now. Let's get into that.
So when it comes to research, what is happening in the field of diabetes? So one of the things that that have been novel is something called continuous glucose monitoring,
Yeah.
CGM. These are specialized devices. Unlike normally persons at home, when they have to test their blood sugar, is usually you gotta take the little prick, take the machine, read the blood. So you basically pricking your fingers or toes
Right.
or whatever almost daily, sometimes 3-4 times a day to
Wow.
do your blood to
Right.
test your blood
Blood
sugar.
sugar.
There are new devices where like with a single patch they can put onto the skin
Wow, you
that can
lying.
last, yeah, and certain manufacturers can last a week, a month, and it can measure your blood sugar at any time
That's something that recently
continuously.
came. That's
Yeah,
a new
that's
something
a
that
new in the field of
new method.
diabetes.
New,
Yeah,
oh, that's
and it
nice.
can actually, and with all the smartphones and so on, it can actually send that information to your phone via Bluetooth. So you can
Wow.
literally pull up your phone and check what was your blood sugar an hour ago, and you can
And
set it
I
at
know a lot of people's gonna
frequencies,
like that
at
one.
intervals, and so on.
They're gonna definitely
Yes.
like that one. So
Also,
it's upgraded. It's upgraded
yes.
from that prick.
Exactly, exactly. So you, if you have family abroad, for example, or if you
Right.
have the means to get those, or if you know anywhere in Guyana that sells, or so on, you can look into it. You can talk
Right.
to your doctor about getting something like that.
That's
You
nice.
know,
That's really nice.
yeah.
And I'm sure people appreciate that.
Yes.
Yeah.
They're also now looking at artificial pancreas, as we mentioned before. The pancreas is the organ that actually makes that insulin that helps you to
Burn.
use up that
The
sugar in the
sugar.
blood. A lot of people have a lot of issues with their pancreas, so scientists have been trying to research and develop something called an artificial pancreas, whereby this implantable device, will now be able to secrete or give off insulin based on your blood sugar at any given time.
Wow.
So it's not a case where you prick your finger, oh, my blood sugar is 300 and something, I gotta give myself 10 units soluble insulin. But no, it
Wow.
just monitors it on its own, and it would secrete just the perfect amount of insulin without you even having to think about it.
Wow. Maybe that's why you like science so much and you followed it because it's really interesting to
Yes,
know that
yes.
as humans that we can come up with all kinds of beautiful solutions
Yes.
that can actually help humanity and health. That's amazing. That's
Yes.
really amazing. So
Yes.
that's really nice.
Yes. So, in conclusion, just for a few take-home points, is to know that diabetes, it is indeed a chronic condition, but it's not a life sentence.
Right.
It can be managed. All doctors across the entire country are so willing to help you to manage that diabetes, because we see the complications every day, and we would love when our patients come in very seriously to us. They're serious about their health, serious about taking their medications and so on. We really would like to see a decrease in the prevalence of diabetes
Right.
and hypertension in our country. As we know, we are now an oil producing nation, and health is wealth, as the
Yes.
old timers like say, health is wealth.
Well,
So we have to stick around to be there for our kids, be there for our family, be there to enjoy whatever bounty is going to come out of all of this. It makes no sense we have all these things, or we'll eventually get them and we're sick.
yeah,
You
that's true.
understand? So, take your health serious, very important, especially the men out there.
Mm-hmm.
Research found that men are less likely
Mm-hmm.
to seek medical advice and to check the doctor. So all the
Oh.
men, they should try their best.
Yeah,
you know.
that's true. That's true. Men are, yeah, they're because my dad between my dad and my mom, she more goes to the doctor.
Yes.
And he doesn't. He
Yes.
just go to the drugstore and buy something from a fever or this or that.
Yes.
So the men, yes, because we know you guys have big egos out there. We're telling you to get yourself checked because you know you don't want to end up in a situation where you're gonna regret. Oh, I had a heart attack or I had a slight stroke, and now I'm gonna treat myself for what had caused that, which might be diabetes, right? So is there anything else you wanna?
Yes. So if at any time you feel like you are not well, and
Yes.
you think you may be having some of the signs and symptoms of diabetes, and also you would know that you had a family history as well, you can go to your nearest health center and ask to see the doctor.
Right.
And one of the most beautiful things in our home country of Guyana is that healthcare is absolutely free.
Free. Say it
you know.
again. Yes.
So I am imploring the citizens of this country to just take advantage of that free health care, you know.
And get yourself on the good road to good health
Yes,
and long life.
exactly. And we are seeing improvements throughout the entire healthcare system. So take advantage, go. Even if you don't want to go public, there's also the private route that you can take. But however you choose to do it, it's your health. Just ensure you make it a priority.
Good. And where can we find you, doctor? Which hospital you're stationed at?
So currently, I was recently recently placed in the internal medicine Georgetown Public Hospital Corporation.
So we can find you there.
Yes, I'll be there.
Okay. Well, it was a pleasure having you here in the studio today. I want to say thank you so much for coming out and sharing your knowledge, giving us your time, which you can never get back. We love you for that. And I hope to see you again, and maybe we cover another topic.
Yes, yes.
I hope to see you a whole lot more again, where we can cover, because as you said earlier in the show, one-on-one you have to do with patients, and it's all day, and then
Yes.
you can't spend as much
Yes.
time. But on the radio show,
Yes.
you can spend an hour or 45 minutes, and you get to cover a whole lot of people. There's thousands of people right now
Yes,
listening to us.
yes.
Don't worry about that live. There's so many people that are locked into the radio, and they're
Yes.
educated. So I want to say thank you so much again,
Yes.
and we're going to follow it up, all
Yes,
right?
it
So
was
any
a-
questions?
It was a thrilling experience to be here, and I would just want to thank the Sunday Simmer team for inviting me and having me on the show. And I really look forward to indeed doing that follow-up session, and maybe we can consider other topics too.
Wonderful, wonderful.
Yeah.
Is there anybody you want to say good morning to, or shout out to, or your team, or your workmates, your family at home? You can do it.
Yes, I would like to say good morning and a shout out to my family, my brothers, my sister, my wife, my mother. I know she's listening.
I
My
know
aunt
they're all
the way in
Proud
Barbados.
of you. They're all
She
proud
made
of you,
sure
aren't they?
That she tuned in. Yes.
Yeah, and he's a pretty young doctor. I mean, a very young doctor. So I commend you. And with your speech on the radio, wow, you blew it away. So that was Dr. Jamal Shamsuddin for you there. And we're going to definitely get back into the music. It was a pleasure sharing information and having conversation with this doctor in the studio. And I just want to say thank you guys for locking in. If if you missed the show, you're now coming on. There is a live, it's on EduPage. You can look at it back. You have all the information you need. You can drop a comment there. We're going to answer all your questions on the next segment, where we do a follow-up of answering any questions that you might have. So let's get back into the music. My name is Anne Marie, alongside me DJ Static, and this is called Sunday Simmer. So let's get right back into that music.